Hi, my name is Dani Ondreka, exercise physiologist with Kettering Health, and today I am joined by Dr. Melissa Butler here in the studio to talk a little bit about exercise and how it affects our aging population. So do you want to tell us a little bit about yourself and what we're going to talk about today?
Sure. My name is Melissa Butler. I'm an internal medicine physician practicing at Years Ahead Health Center, just around the corner on Clio. I primarily service a senior population, generally focusing on 65 and older patients. And I'm very passionate about exercise and the importance of exercise as we age.
So you already work with the senior population,
Yes.
So you're a little bit uniquely qualified to discuss this topic of exercise as we age. So tell us a little bit about what you see on a day-to-day basis with your patients. Are they exercising? Are they not exercising? What is kind of the general trend?
Right. So I do have a fairly large number of patients who do exercise on a fairly regular basis, mostly walking. But one of the things I really notice, because many of my patients have either are newly transitioning to retirement, have just retired, maybe several years out from retirement. And so I'm able to see them, a lot of them, pre-retirement, and then watch what happens in the years following retirement. And, working naturally keeps us a little more active.
Yeah.
Just getting in and out of our cars, getting dressed for work in the morning and getting out and being away from home most of the day. And so even if you're not intentionally exercising, your body is active on a much more regular basis, hour after hour through the workday. Once people retire, many people have great intentions about what they're going to do. But even if they are accomplishing some of those things, their lifestyle suddenly becomes much more sedentary. And I notice a dramatic functional decline. And what I mean by that is that their bodies are stiffer. And even in the absence of weight gain, they have more pain. Their balance starts to deteriorate. They simply don't move as well. And as I've noticed this, I really try to stress the importance of incorporating regular and intentional exercise into their routine.
So tell us a little bit about the specific benefits of exercising as you are aging.
Right. So exercise, of course, is good at any age, right? So it's really good, even in children and in young adulthood, to encourage just that habitual movement of our body. But particularly as we age, we have natural muscle atrophy that it starts to occur. It can be as much as 0.5% of muscle mass per year after the age of 50, which, if you can imagine, that's a lot. And what the muscle's replaced with is fat. So again, even in the absence of weight gain, you are getting proportionately more adipose or fat tissue. And so that can have negative health benefits for sure in terms of cardiovascular disease and metabolic diseases like diabetes and, high cholesterol and increased cancer risk, quite frankly. So those are some of the disease processes, but just in terms of the movement of our body, our balance starts to deteriorate. And then now we start getting into trouble with falling, ability to just carry out the chores that we want to carry out on a daily basis, keeping our house clean, putting the dishes in the dishwasher, things that we wouldn't have even given a second thought to in our younger days. Now they're becoming really difficult. So by continually keeping our body strong, we can really either, not even get into those kinds of problems, but we can reverse and just prevent some of that decline.
Yes, and maybe continue to do some of the things we already really love to do in the first place. Maybe you had activities that as your balance is changing or as you don't feel as strong or as confident in your movement, you just stop doing.
Right.
And that can put a strain on your mental health as well, strain on relationships, perhaps with family. If you feel like you have a hard time getting to your grandkids' games, maybe walking across the soccer field is really tough for you, so you just don't get out there. And those are all things that you should really have the ability to be a part of if you want to.
Yeah, exactly. And I mean, you mentioned, even just seeing grandkids' games, that's a really great example of things that people start to withdraw from because it's hard. Walking up bleachers is difficult. The grass, if your balance is poor, walking across the grass becomes problematic. And again, even 5 or 10 years prior, you may not have given it a second thought. But if we continue, again, to use our body, it does not have to be that way. It can be just as easy as it ever was.
Yes, we can be proactive as opposed to necessarily being reactive.
And I think that in our culture, it's really hard, and maybe it's just human nature in general, to think ahead to the future, about what is going to happen to our bodies.
Yes.
But I really, especially as we get older, it becomes much more, important to intentionally exercise. A 30-year-old, their bodies are still strong and they can get away with less exercise. But if we're 70, and suppose we're admitted to the hospital, there are studies about this. Somebody's admitted to the hospital with an illness, say pneumonia, and maybe they have an inpatient stay of 5 days. At the end of that 5 days, there is already detectable muscle atrophy and functional loss.
Yes.
And so there's a movement really to try to get these patients moving. And if anybody has been admitted recently, they'll notice that physical therapy comes in now right away because we want to try to combat that. So, even as little as 5 days of being sedentary, you're already losing.
It's huge. But if you're going to have a surgery, or if you're possibly going to have a hospital stay that's upcoming, it's also really important to recognize that if you have that muscle mass already, it's really going to help you with your recovery too. So it's not to say you should be afraid of doing those things because you're going to lose muscle mass. You can really start to build up to help set that foundation for yourself.
Absolutely.
That's fantastic.
Yes, absolutely.
Wow. So how much exercise should an older adult be getting throughout the week?
Right. So the minimum recommendations are 150 minutes of aerobic exercise per week. And so that equates to about 30 minutes, 5 days a week. It's really not that much, but now that is the minimum. And by aerobic activity, that can just be walking. Now, I'll take any walking over sitting on the couch, but it does have to be at a clip enough where you notice a change in your breathing. So maybe you can still carry on a conversation, but there is an increase in your heart rate. You want to get that heart rate up. But again, you don't have to be out there killing yourself. You don't want to run a 5K, that's fine. You can walk it. But you do want to get that heart rate up. So that's the minimum. And it can be split in different ways. You don't have to necessarily do a continuous 30 minutes a day. You could even do 45 minutes and then do less days if you like. My recommendation generally is to move more days than you don't, though. I just think it's better for our bodies. And I think people feel, especially people who have arthritis and chronic pain, you actually feel better if you're moving regularly. And that can be a hard concept for some people to realize because they feel like they're going to hurt themselves. But in fact, you feel a lot better with the regular movement. You can think about it as like lubricating your joints almost.
Yes.
So that's the aerobic portion. And then there's also strength. You want to keep your body strong. So some sort of either calisthenics, using your body weight for strength training. You can use very low weights, 5-pound weights, or for some of my really older female patients in particular, I'll say even soup cans or something, just real low weights. So you want some strength training too. And that can be, like I said, yoga, body weight, at least 2 days per week, preferably 3.
Yeah, that's phenomenal. And making sure you're hitting the upper and the lower body as well.
Exactly.
Yes, especially when it comes to balance, that lower body becomes very important.
So, and I didn't mention that part. So the aerobic and the strength, but balance exercises also are really important. So yoga is really good for that. Tai Chi is really great. I mean, but these days you can go on YouTube and Google. I mean, you can look up all sorts of free, small, segments of exercise that are targeted to specific demographics. So doing balance exercises regularly is really good for us too.
Absolutely. Absolutely agree. I like that we kind of hit on all the different types there and that it is all additive. So even though we may only have time for 10 minutes in the morning, maybe later in the afternoon, we have time for a little bit more.
Absolutely.
So it doesn't mean we have to have a specific regimen for 30 to 45 minutes a day where we go to one specific place and we do the same 5 motions. You can mix it up a little bit. You can still do the things that you love and incorporate that into your movement as you go throughout your day.
Yes, for sure.
I love that.
Right. It doesn't have to be continuous. It does not have to be in a gym. Nobody needs a gym.
Yeah.
Now, most of my patients do have silver sneakers, so they actually get free membership to any number of gyms.
Yes.
But it's not needed. You can just walk in your neighborhood. You can go to a metro park. We have lovely metro parks, and many of them still have, with plenty of paved trails. And strength training can be at home.
Absolutely.
Yeah.
And I love that you mentioned silver sneakers too. And you can even check with your insurance carrier. A lot of times they do cover or provide cheaper gym memberships other places as well.
Right.
So you can always see what they have available to you.
Right. And that way, so if I have somebody who does have, maybe they have really severe back pain or knee pain, and, walking is not feasible for them anymore for whatever the reason may be, if they utilize a silver sneakers or insurance benefits for a cheaper gym membership, go to a pool. I mean, you can do pool exercises, which are great. You can walk in the pool, aerobics in the pool. And actually the YMCAs have so many classes, so many options through the day. And it's a way to have a social outlet as well. Many of my patients who do go to the YMCA, they develop good friendships in these classes and they actually enjoy going. And that's a benefit as well.
Helps to keep you going.
That's right. That's right.
Most definitely. Most definitely. So if you were to see maybe say a brand new patient who is 75, 80 years old and has never exercised before and needs to know, okay, how am I going to start? What would you tell that patient?
So generally I would, with this patient, if they've never exercised, and especially if their conditioning is very poor, so their endurance is poor, sometimes, if they're willing, I will encourage a membership to a gym because oftentimes there is a free consultation with somebody there who can at least give them a very small strength circuit. So on weights or free weights, whatever it may be, if that feels very intimidating, what I usually start with is just walking. And I'll say start with 5 minutes. Do 5 minutes every day. And then just, next week you'll do 6. Next week you'll do 7. If you're consistent, in no time you're up to 30 minutes. It is really the consistency. And really everybody can do it. We just simply have to get it into our mindset that it's really not an option. If we want good health, this is necessary. There is literally no substitute for exercise. There is not a pill on earth. There's not a treatment on earth. There's not a knee replacement or hip replacement or back surgery that is going to make you feel better or do something greater for your health than exercise. It is the single best thing that you can do for your health. From literally, you give me a body system and I'm going to tell you how exercise will benefit it.
Absolutely. Yeah. Every single piece of your body was made to function due to exercise and movement. Yeah. Movement is medicine.
It really, really is. It really is. And in terms of aging, I mean, you look at people who exercise regularly, they age slower, literally aging, even if you look at on cellular level.
Yes.
So
I think we've all seen the groups of walkers, maybe you have a walking group in your neighborhood and you see them around, about what time they're going to be out during the day. They're consistent, right? And they're still out. They're still doing things. They're still super active. And it's because they don't stop.
Right.
And I love that. I love that consistency. So even maybe starting a group might be something that's helpful. Grabbing a friend to do something with.
Right.
If there are days that you feel like you are very unmotivated, because let's face it, we have those days.
Oh, yeah. And I know the weather can be poor too, but most of us have lived in Ohio for a very long time, so we should be accustomed to it.
Or
and we
have
can anticipate.
A plan. Yeah.
Right. And you can have a backup
plan. If you're
like,
wow, today's going to be bad weather. What's something I can do inside my house? Do I have a stair that I can just do a little step up and down on? Can I do some little squats down onto my couch, making a full sit and standing back up? Make a game plan so that you don't just have to throw in the towel and quit before you even begin.
Right, right. And, the other, so not only weather or inclement weather or bad places to walk, but the other thing I hear often is lack of time.
Yes.
So do you want to speak to that and remind people that we really, really do have time? I can't tell you anybody on earth that does not have time to exercise. So, the President of the United States exercises regularly. And if he has time to exercise, so do you.
And he's a busy man.
That's right. Absolutely. It really is not, it is just, and I don't want to make people feel badly, but we do have to be honest with ourselves and what excuses we make and the impediments we put in our own way that really don't exist. We all actually do have time. We just have to make it a priority.
And that's exactly it. What are your priorities?
Right.
And it's so amazing to have these priorities of being with your family and doing things like paying the bills and doing chores around the house. Those things are very, very important. And yes, they still need to be done. But can those dishes wait 5 minutes so that you can do a couple exercises before you finish doing them?
Right.
What are you making a priority? Because if you decide it's important enough to you, you're going to do it.
Right.
You just have to decide what the give and the take is.
Right.
is my health that important to me?
Right.
Do I care enough about my body and about its longevity to move? And if you make that decision about that importance and you really start to see that rank come a little bit higher, your everyday life will absolutely change. You'll suddenly find that time. You'll find that 5 minutes, that 7 minutes, that 10 minutes. And that's all you need. That's it.
All you need. Yep. Yeah.
Wow. I love that. I think we could really talk about this all day.
I know. I know. It really is truly my passion, exercising, simply because I promise every single person, if they are not currently exercising regularly and they start a program, in 6 months, the difference will be remarkable. And just in terms of how you feel, in terms of energy levels and chronic pain, it does reduce significantly.
That's phenomenal. Well, you can definitely see your passion.
Yeah.
And I'm sure your patients appreciate it. I hope they do.
I hope they do too.
I hope they do.
But I do. I ask every patient, if I'm meeting with a new patient, I ask everybody about exercise.
Mm-hmm. Mm-hmm. Well, is there anything else you think that the folks listening should know about exercise?
Yeah. So one more thing I know that people do worry about is if they have heart issues or, they worry about, are there contraindications to exercise? And there really are almost none. There's almost none, because even post-heart attack, people do better exercising. You just want to start, like I said, slowly, 5 minutes, walk for 5 minutes and then slowly increase it. But really, there's virtually no contraindications.
Yes.
So it doesn't matter what your health issue is. And in fact, most health issues will, like I said, improve. Parkinson's disease, people who exercise, the progression is significantly slower. Multiple sclerosis, people who exercise, the progression is significantly slower. So really anything is made better.
Yes, absolutely agree. And I think one of the coolest things about you being inside your body, living in your body, is that you know it better than anybody else does.
Mm-hmm.
So you've lived in it for a very long time. Okay. You've lived in this shell. It is yours. No one else can quite understand its inner workings like you do. You know when things feel wrong. You know when things feel kind of off. So if you are starting to move and things are feeling strange, you can always stop. You can always take a break. You can always contact your doctor if you have questions. Right. It is always okay to do that.
Right.
But if you are not, a regular exerciser, maybe this is a really beautiful time to get to know your body in a better way like that as well.
Right.
So
exactly.
that, as you continue to age, if things start to happen that are really wrong, you're more able to recognize those signs because you're so in tune with your body and how it feels.
Yes, that's exactly right.
So good. What a good conversation.
Well, also, one more thing I would like to say,
please,
for those who do like the social network, Dayton actually has a lot of exercise groups. They do. There's walking groups, there's running groups. There are a lot of 5Ks out there. Many people walk. Those are really fun for people who aren't walking yet. Start signing up for some 5Ks and just walk them. It's really fun atmosphere, very supportive people. I mean, runners and walkers, they're a really uplifting and motivating crew.
Yes.
And so I think that's a really fun way to do it.
And you get a t-shirt.
And you get a t-shirt, you get a medal, you get free, food afterwards.
Yes.
It's a really fun kind of environment. And then all of our biking trails are lovely.
Yes.
Our metro parks are amazing.
We are really, truly so blessed here. There is so much possibility.
Right.
All right. Well, is there anything else that you'd like to add before we finish today?
Just encouraging everybody to get out there and move. And today's the day.
Yes, today is the day. You can really start anytime. Maybe today is the perfect time.
Yes.
Well, thank you so much for joining us, Dr. Butler.
Thanks for
it was
having
really
me.
A wonderful conversation. Thank you for sharing your insight.
Thank you.
Yeah. Well, we hope you all have been encouraged to exercise just a little bit more. Like we said, if you have any questions, please feel free to contact your doctor if you have any concerns about movement. But we really just want to encourage you to start somewhere, start moving. Why not start today? So thanks for joining us. Have a wonderful rest of your day and stay healthy.